Hi everyone, I am Dr. Prudhwiraj, consultant endocrinologist at Arete Hospital, Gachibowli, Hyderabad. We all know that March 4th is celebrated as World Obesity Day. To increase the awareness about the obesity, I am doing this video. You all know that when you open the social media, everyone is talking about this obesity and the weight loss medicines. Every influencer is talking about these medicines and the obesity. At the end of this video, you will get to know for the right guidance of obesity whom you need to contact. First of all, if you see, look at the numbers, around 1 billion population in around the world are now suffering with the obesity, and it is expected that by 2035 at least 4 billion population will suffer with this obesity. That is 1 in 2 people will be suffering with this obesity. First of all, to identify this obesity, we have multiple parameters. The most common parameter which we use is the body mass index. If your body mass index, especially Indians, is more than 25 kg per meter square, you will be labeled as obesity. In some special cases, even though your weight is normal but your body fat percentage is more, then you will be considered as normal weight obesity. For males, the body fat percentage, if it is more than 25%, for females, body fat percentage is more than 30%. Even though you are weighing normal weight, then we should consider you as a person with obesity. We have to see the causes for this obesity. If we have to divide the causes, two main causes. First thing is the endogenous causes. That is inherent defect in the body mechanism in dealing with the fat, carbohydrates and all. This endogenous. And the second thing is the exogenous. Exogenous causes can be outside your domain, body's domain. That can be poor eating habits or sedentary lifestyle or psychosocial factors, or it can be regular night shifts. These are the outside factors which is disturbing the body metabolism of managing the calories and the fat, leading to the obesity. Coming to endogenous, that is inherent body defective mechanism. It can be again either broadly classified into genetic. In the genetic, it can be sometimes monogenic, abnormality in one single gene like leptin gene or some other genes. If you are suffering with very morbid obesity or childhood obesity, we need to screen you for the monogenic obesity, and there is certain specific treatments for those monogenic obesities. And majority of the people will be having with some oligogenic or polygenic obesity, that is multiple abnormalities in multiple genes. The second cause is the hormonal. The hormonal causes can be either hypothyroidism or increased cortisol production, Cushing's, or growth hormone deficiency, or hypoparathyroidism, or insulin resistance. These are all the hormonal causes that can cause the obesity in the people. And if you see any person suffering with obesity, it is usually not one cause. It is always multifactorial. It can be because of polygenics, plus hypothyroid, plus poor eating habits, plus poor psychosocial environment. So there are multiple causes for the obesity in a single person. So we need to identify each and every cause, and we need to address each and every cause while we are treating the person with obesity. Now, what are the complications of the obesity? At least 10 metabolic conditions and 4 cancers are associated with increased prevalence of obesity. The metabolic conditions that can be expected are young onset diabetes, hypertension, premature atherosclerotic cardiovascular disease like heart disease, strokes, fatty liver disease, obstructive sleep apnea, early onset osteoarthritis, sexual problems, morbid obesity, secondary hypogonadism, or subfertility or infertility, or some cancers like breast cancer, colon cancer. These risks are increased risk in the persons with obesity. So these are all the metabolic conditions that can be prevented by addressing the root cause, that is the obesity, excess body fat tissue. Now the next thing is the treatment part. The treatment part, again, first of all, we need to identify the phenotype of the person. If we have to broadly classify a person with obesity into phenotypes, I can say 4 phenotypes are possible. One thing is hungry brain. That is, your brain lost the satiety mechanism. These people usually can tolerate prolonged periods of fasting, but once they start eating, they keep on eating and nothing can fulfill their appetite. That is, they will have their proper meal, they will eat their dessert, they will eat their ice creams till they crave for the food, but they can survive prolonged period of fasting. Some patients complain that, sir, I don't eat any breakfast, I don't eat any lunch, but I will have only one meal a day. But if I ask, what are you eating? He says that it will be a very huge meal and nothing will give him the satiety. So he will keep on eating till he gets that satiety. So some people belong to this hungry brain category. They have abnormality in the satiety signals in the brain. And the second type phenotype, if you say, they can be hungry gut type. Some patients will keep on eating every couple of hours. Normally, if we consume the food must travel from esophagus to stomach to the intestines, and this transit time is anywhere between 1 hour to 4 hours. For some people it is very less, so that they will be feeling hungry every couple of hours. They keep on eating everything every 2 hours. They will eat breakfast, they will eat snacks, they will eat lunch, they will eat snacks again, they will eat snacks again, they will dinner again. They keep on eating because their gastric emptying time is very low. They feel hungry all the time and they keep on eating the food, leading to excess consumption of calories and the fat deposition and obesity. Coming to third phenotype, these are emotional eaters. Majority of the Gen Z or young females, if you see, they belong to this category. They always correlate their emotion with the food. If they are happy, they want food. If they are sad, they want food. If they are angry, they want food. And they always replace their emotion, they fulfill their emotions with the food. For them, adequate behavioral modification has to be done. And fourth phenotype, if you see, are the slow burners. For this category, the total daily consumption of calories is on the lower side only. However, there is decreased resting energy expenditure and the decreased non-exercise adiposity thermogenesis. Because of this decreased metabolism, their energy dissipation is also very low. That's why they keep on putting on the weight and they find it very difficult to lose the weight. So first of all, we need to identify the obesity phenotypes and we need to modify their habits accordingly. I cannot say universal umbrella precautions for all of them. For example, if the patient is having a hungry brain, I may advise them to eat high protein breakfast and I may advise them to take protein supplement or protein portion in the first during the meal consumption. And if the patient is having hungry gut, I may ask them to take high fiber, especially before the meal, so that their gastric emptying time can be delayed and so that they can have a prolonged gastric emptying time. And for the emotional eaters, we need to give them healthy snacks options and we need to condition their brain to replace this emotion with food and all. And coming to slow burners, we need to train them exercises. We need to introduce them resistance training exercises, muscle strengthening exercises, and we need to gradually every month increase the intensity and duration of the resistance exercises to increase the resting energy expenditure and thermogenesis. So for every individual phenotype, we may advise some dietary and lifestyle modifications to have a healthy weight loss. As obesity phenotypes, I have classified into 4 times. It is not that simple, which I have classified. If you see, majority of the people may have more than 2 phenotypes. For example, if patient may be having hungry brain, some people may have both hungry brain and hungry gut. Some people may have hungry brain and emotional eaters. Some people may have hungry gut and slow burners. And some people may have all the 4 also. So we need to identify them and we need to modify their lifestyle habits to manage to treat their obesity effectively. Coming to lifestyle modification for the obesity, we need to address all the domains. One thing is diet. What they are eating, how much they are eating, at what time they are eating, everything is important. So we need to correct them personalized for each phenotype and the mixed phenotypes. And again, physical activity. We need to do both cardio advice and resistance training exercises. We may start at a very slow pace, but every month we need to increase the intensity and duration of the exercises. Third thing is we need to advise all our patients to have at least nocturnal sleep of 7 hours. Stress management is again important. Stress is a part and parcel of everyone's life. How we are reacting to that stress is very much important, and we need to train our brain to manage it more effectively. Lifestyle modification, all these 4 domains has to be addressed while talking about the obesity treatment. You all know that pharmacological management has changed drastically, especially with the coming of Ozempic, Wegovy or Mounjaro, semaglutide. Everyone is talking about this, and tirzepatide, all these things coming, retatrutide and all. So who should take these molecules? If you have BMI more than 25 kg per meter square and plus type 2 diabetes or fatty liver disease or sleep apnea or secondary morbid obesity, secondary hypogonadism, infertility, these are all the conditions that needs to be advised this pharmacological management under the supervision of a doctor and endocrinologist. So one message I want to give clearly is there are multiple domains in evaluating the obesity and treating the obesity. It is not like one size will fit all. One size does not fit all. We need to personalize the obesity treatment, and the correct person to guide you and personalized treatment is endocrinologist. So if you are suffering with obesity, please meet the nearby endocrinologist and get correctly evaluated and correctly guided. Thank you.